Our role is, of course, mainly or even exclusively concentrating on the congresses. But we have a series of congresses, of course, the one that is called ECO, which is the big multidisciplinary platform. And then we do, on behalf of some of our members, we organize their congress also. So that's our CME activity. Clearly, when we speak about funding of the CME, in the case of congresses, is mainly supporting delegates, inviting delegates, as it is called by the industry themselves. So meaning paying the registration fee, paying the travel, and paying the accommodation, and maybe some additional meals, and so on. And that is certainly decreasing a lot. We come from a majority of participants who were invited and supported financially by the industry, to now less than 50%. And that's over an evolution, let's say, that we know now over 5-6 years, something like that. So it is impacting, of course, the individuals, and probably also as a consequence the congresses. However, we're lucky enough to experience this shift of practice from the industry in an environment, in a growing environment, because our congresses keep growing. So there's two lessons I could take out of this. Probably big congresses, big in size, are more interesting, more attractive to participants than smaller ones. And it seems that it is the case that some smaller congresses that we organize or that we see organized by colleagues are losing in attendance when big ones are gaining. Secondly, there's also the fact that oncology is way far to be solved, of course. And unfortunately, I use marketing terminology here, but we could say it's still a growing market when you have other diseases where they're plateauing. So those two factors help us to keep having very performing congresses. That article that has been mentioned during the session came as a surprise, of course, because, as you said, it is a natural feeling that we believe if the industry is paying something, that means it is biased, that means they have a commercial interest. And it's probably the case, or has been certainly the case in the past, and in exaggeration. The thing is that I meet more and more leaders or management people from our partners in the industry who demonstrate a will to participate, to collaborate without this automatic commercial component. And I kind of try to understand that there is something trustable there. And it's all a question of trust, of course. We're very afraid, and we're not only at ECO, but also other colleagues organizing congresses, we're very afraid of having our scientific program being biased by the industry, and we keep building firewalls to protect us from any influence. But maybe we are in the process with all these new rules, new regulations that are exaggerating in the other way, in the opposite way of the previous way to work or to act. Maybe we are in the process of gaining some maturity, we all together, the industry and us, the scientific societies, and that there will be at a certain moment a point of contact and a point where we can collaborate together and for the cause that we're working for, which is finally getting improvement for the patient. So it's a hope, at least, that I have, but I feel that there is some components there that are designing a possibility there for the future. The Congress we organized next year in September 2015 in Vienna, the European Cancer Congress, the particularity of it is that it focuses on the multidisciplinarity. Multidisciplinarity, I'm sorry, is a word that is commonly used now in oncology by many congresses and by many organizations. But because of that, I'm adding an adjective, and I say the true multidisciplinarity. Because what we believe is that our organization and the Congress that we're putting together should reflect what the ideal tumor board is, meaning that there is a real collaboration among the different professionals to decide what a treatment should be, without having an automatic dominance of one of the participants of the tumor board. But depending on the specific case of a patient, it should be then one of the disciplines, one of the specialists that takes the lead for that patient specific. But in a different case, it should be a different HCP, a different professional that should take the lead, depending really of the way the best solution would be designed. And our congresses, that's what we're trying to do to reflect that model.